Good afternoon. Today I'll be doing a video on the frequently asked questions about the coronavirus. So the first question that is perhaps the most important is, what are the symptoms of the coronavirus? Common symptoms include fever, a dry cough, fatigue, and difficulty breathing or shortness of breath. Some of the symptoms overlap with those of the flu, making detection difficult, but keep in mind that runny noses are less common. The CDC has also added chills, muscle pain, sore throat, headache, and new loss of sense or taste or smell as symptoms to look out for. Many people fall ill 5 to 7 days after exposure, but symptoms may appear in as few as 2 days or many as 14 days. So keep in mind here that symptoms vary from person to person, so a heart attack or stroke could be a symptom of the coronavirus in some people as well. The second question that I'm sure a lot of people have is the coronavirus airborne? And the answer is yes, it is. The coronavirus can stay afloat for hours in tiny drops in stagnant air, infecting people as they inhale. The risk is highest in crowded indoor places with poor ventilation, and this could help explain why the virus is severe in meatpacking plants, churches, and restaurants. The virus is often spread when a sick person coughs or sneezes or even breathes, and other people can also be transmitted through contaminated surfaces that an infected person has touched. Aerosols can be released even when a person without symptoms or asymptomatic exhales, talks, or sings, according to many experts. The second question that a lot of people have also been asking is, does asymptomatic transmission of COVID-19 happen? So basically, people who have the virus and are asymptomatic do transmit the virus. A widely cited paper published in April suggests that people are most infectious about 2 days before the onset of coronavirus symptoms, and that 44% of new infections were a result from transmission from asymptomatic people. So this just proves that we all need to be careful. Even if we maybe knew someone who may not be showing symptoms, we could still get the virus, and if we are perhaps contagious and we don't even know it, it just outlines the importance for protection to the coronavirus. Now, I think this is a really important question, which is, how do we protect ourselves from the coronavirus? The first thing to do is to wear a mask, and many papers and researchers have shown that wearing a mask will greatly decrease the risk of you contracting the virus, and so wearing a mask is the most important thing here. Also, just for healthcare workers or essential workers, you may need an N95 mask, but for other people, I think cloth or surgical mask is sufficient enough to protect you from the coronavirus. The second thing to watch out for if you're going to be going out is to social distance. 6 feet is the distance you want to be keep away from other people, and it has been shown that if you stay 6 feet apart and wear a mask, your risk of contracting the virus is pretty low. Also, you wash your hands frequently and often, because you can't get the virus from surfaces like I mentioned. So washing your hands frequently can get rid of the virus as well. Therefore, the 3 main means of protection I've mentioned are social distancing, wearing a mask, and washing your hands. However, often enough, the best way of avoiding COVID-19 is to just stay home. Don't go out, keep indoors, and go out only when necessary, and take those precautions which I mentioned. The next important question that are frequently asked is, what do you do if you think you're sick? So if you've been coughing, or you just simply feel sick and have symptoms of the virus, which I mentioned at the beginning, call a doctor. So they should give you advice on whether you should be tested, how to get tested, and how to seek medical treatment without potentially infecting or exposing others. You can also get a test depending on the state if they offer widespread testing for people who have symptoms. And I think there are also places such as where I live in California where they offer tests even if you don't show symptoms. That's it. Thank you for listening, and I hope you have a good day. Thank you.